Been raised about the number of adult mental health patients being held in locked rehabilitation wards in England. The Care Quality Commission says a significant number of the 3,500 people being kept in these conditions could be living with fewer restrictions. Our health reporter Smita Mundasad reports.
Jeff Clark spent years locked in psychiatric rehabilitation units after developing schizophrenia.
I was there 11 years. And it was very, very boring, not a lot to do, people you didn't get on with, things like that. Not a very pleasant place to be.
He's now back in his community close to home. But more than 50 years on from the movement to abolish asylums, England's health regulator is worried too many patients still risk being institutionalised on more modern, locked rehabilitation wards. The report is clear for mental health care in the 21st century that a hospital should not be considered a home.
That quite a high proportion of people in these services could and should be moved back to be much closer to home and be cared for in settings, in residential settings that are much more, provide much more independence.
And CQC inspectors say safety is another major concern. They rated about a third of services as needing improvement, and 1 in 20 were deemed inadequate. Their report says old buildings with blind spots that make it harder to monitor patients and a shortage of nursing staff could leave people at risk.
That raises big questions about this system and what's happening in the system. Is there enough money in there? You know, actually, do we have the right kind of people able to deliver the care? But it also says something about the culture, what's happening in an individual setting. Is there the right leadership? Are people involved in their own care? Actually, people supported and trained in such a way that they can deliver that care.
But the CQC praises staff for being caring and treating people with dignity and respect at the vast majority of trusts. NHS England says big steps have been made in improving mental health services, with more money going into the system. But it agrees there is still more work to be done. Smita Mundasad, BBC.